Each and every girl after natural conception should aim for normal vaginal delivery. Birthing is a very natural and physiological process gifted to the human body by the nature. No matter if you land up in C-section eventually due to some or other emergency condition, because that decision is taken by your doctor for the betterment of you and your baby. But if you carry a normal and a healthy pregnancy, then you should definitely work on yourself, put some efforts right from the start itself to attain vaginal delivery. Hello and welcome to Trupt Wellness. My name is Dr. Trupti and today we are going to see 5 yogasanas or simple and safe exercises which you can do to attain normal delivery or vaginal birth, or it will also help to ease your labor process. Being physically active is very important right from the start of your pregnancy if you are preparing yourself for vaginal birth or normal delivery. Now, staying active doesn't mean that you have to join the prenatal yoga classes immediately as soon as you know that you're pregnant, or you have to hit the gym. But instead you have to continue doing the regular chores which you used to do earlier before getting pregnant. Like you can continue the sweeping or mopping in a squat down position. You can use the Indian toilets. You can climb the stairs which you were climbing regularly before. You can take small walks in the verandas or the nearby gardens. You can also sit down on the floor in crossed leg position. So these are the things which you need not to restrict just because you are pregnant, unless and until your doctor has advised to limit some or other physical sort of activities or advised bed rest. If you are physically active throughout, then your muscles are used to stretching and it helps to adapt the new exercises or asanas which will ease your childbirth process. Now let's see which are those 5 exercises which will help to ease the childbirth process. The first one is Baddha konasana or butterfly pose. Now let's see the correct yogic technique first and then we'll talk about the benefits. Join both feet and bring them close to the groin area as much as possible. Now take a deep breath, and as you inhale, take both the knees down. Try to bring them close to the ground as per your capacity. Inhale. Bring your knees down. 5, 4, 3, 2, 1 and relax. Inhale. Knees down. 5, 4, 3, 2, 1. Relax. You can repeat this 5 to 8 times a day as per your comfort. This Baddha konasana helps in strengthening the muscles of pelvic floor and improves the flexibility. It also opens up the hip, groin, pelvic muscles and the thigh area which ease your childbirth process. This exercise aids digestion and it also eases the pain of your lower legs or limb during pregnancy by improving blood circulation. It helps in fluid retention and it also initiates the delivery during labor. The second asana is Malasana or full squats. Now let's see the safest technique to practice full squats, as due to expanding girth, the sense of balance is weak during last trimester. So we are using a prop and our prop is a chair. Now let's see the technique. Place a chair for support in front of you. Keep your feet about a hip distance apart and lower your hips down slowly with the support of the chair. Your heels should touch the ground. If not, then take the help of a mat or cushion or a pillow and place it below your heels. Rest on it. Now try to push your knees outwards with your elbows. This will intensify the hip opening. Stay there for 30 seconds and you can increase the time gradually. Join your hands and bring it to the heart center. concentrate on breathing. You can also do Kegels in this position. Relax and get up slowly with the support of the chair. Malasana helps in stretching the groin, opening of the hips, and also make a room for the baby. It also helps in easing the childbirth process to some extent. Now let's see when you should avoid doing this Malasana or practicing squats. So if your doctors tell you that the baby is in breech position and you are 32 weeks or above that, then you should never attempt this asana. Also, if you are prone to prolapse, then you have to avoid practicing squats. Third one is if you have piles or hemorrhoids, then also you should avoid doing this asana. And the fourth one is if your doctor has restricted you from physical activities, then you should not do this Malasana. The third exercise is sweeping and mopping during pregnancy. I call it as Desi squats. Now let's see some do's and don'ts for this exercise. Spread your legs wide, pointing outwards. Sit in a full squat position instead of bending. Take small baby steps to move forward. Similarly, with the mopping, keep your feet wide and firm on the floor. Take the support of the floor and practice it like an exercise. This position will not put any pressure on the abdomen. Sweeping and mopping are low impact exercises and are completely safe if you carry a healthy pregnancy. These activities are done by millions of Indian pregnant women since ages, and it has helped them to stay physically active throughout their pregnancy. These are called Desi squats with the help of a prop. Now these activities help to open up the hip, thighs and groin area, which ease your childbirth process and also the labor. These also help to improve the tone and elasticity of pelvic muscle and make the room for the baby. One should not practice these activities in high-risk pregnancy, and also you should suddenly stop doing these activities if you experience cramping, spotting or any leakage or discharge, lightheadedness, sudden nausea or blood vision. The fourth asana is Utkata konasana, that is goddess pose. Now let's see the correct yogic technique first. Keep comfortable distance between the feet. Turn your toes and heels outwards and your knees should be tracking in the same direction. Inhale and raise arms. Exhale and slowly bend arms and knees, coming to a half squat position. Knees should be above ankle. Hold on to this pose for 5 breaths. Repeat the same for 5 rounds. This yoga can be practiced from 28th week onwards. This is also safe during second trimester. This asana helps to strengthen your legs and also open up the hip at the same time. This is a great pose to connect with your baby while you stay there for 5 breaths. And the fifth exercise is duck walks. Every pregnant woman is obsessed with this exercise. Let's see what safety measures we need to take while practicing these duck walks. Spread your legs wide and feet should point outwards. Keep your feet firmly on the ground. Take support of both the hands and the floor. Come to a full squat position. Take small baby steps ahead. Legs should be wide and feet firm on the ground. Breathe normally and take rest after 8 to 10 steps. One important point to note, these duck walks should be done only and only when your doctor says that the head of the baby is fixed in the pelvis. These walks helps to make your childbirth process bit easier, and it also helps to shorten the labor time to some extent. You should not continue these walks if you find pain or discomfort in the abdomen. Also, if there is shortness of breath, if there is any kind of bleeding or discharge from the vagina, and if you experience pain in the groin, vagina or pelvic area. All these exercises will help to initiate faster labor process, and it will ease your childbirth experience to some extent. Keep walking while you do all these exercises. Walking is very important factor in order to descend the baby in the pelvis, to improve your circulation, to reduce the pedal edema or help in fluid retention. It also helps to provide nutrients, oxygen and blood to your baby. I hope this video was helpful. If you have any queries regarding these exercises, then do put a comment and I will answer back. If you like our content, then please hit that like button. It inspires us to make more videos. Also share the videos with the needy ones in your community, and don't forget to subscribe if you are new to the channel. Let's meet in next episode. Till then, stay happy, stay blessed. Thank you.